السلام عليكم طلبة الصف الرابع. محاضرتنا اليوم تكملة لأمراض الجهاز التنفسي اللي هي موضوع اليوم اللي هو diffuse parenchymal lung disease. What means by diffuse parenchymal lung diseases? The diffuse parenchymal lung diseases, which are abbreviated by DPLDS, are a heterogeneous group of conditions affecting the pulmonary interstitium and or peripheral lumen. So the definitions of diffuse parenchymal lung disease is a heterogeneous group of conditions affecting the pulmonary interstitium and or peripheral lumen. I mean, involvement of the pulmonary interstitium alone or pulmonary interstitium with peripheral lumen. This is the definition of diffuse parenchymal lung disease. The natural history, the presentation of these may differ widely, but they are frequently considered collectively as they are sharing similar symptoms, similar physical signs, similar pulmonary function abnormalities with similar radiological changes. So, although by the natural history and presentation they may differ widely, but they are sharing the similar symptoms, physical signs, pulmonary function test, and the radiological changes. The most common type of the diffuse parenchymal lung disease, which we'll discuss today in details, it is called Idiopathic Pulmonary Fibrosis, IPF, which is account about over 85% of new cases of diffuse parenchymal pulmonary disease. This slide shows the classifications of diffuse parenchymal lung diseases. Include diffuse parenchymal lung disease of non-cause, second class idiopathic interstitial pneumonia, fourth class granulomatous diffuse parenchymal lung disease, example sarcoidosis, fourth class of the diffuse parenchymal lung disease, example histiocytosis X or phalangioliomatosis. The idiopathic interstitial pneumonia is subclass or subclassified into the idiopathic pulmonary fibrosis, which we'll discuss today in details. And it's considered the broad type, as I mentioned, consists or comprise about 85% of the new case of idiopathic or diffuse parenchymal lung disease. Other subclass of idiopathic interstitial pneumonia, it is called idiopathic interstitial pneumonia other than idiopathic pulmonary fibrosis, and this include variety of conditions, example like acute interstitial pneumonia, lymphocytic interstitial pneumonia, and etc. So, what are the conditions that mimic diffuse parenchymal lung disease, or what is the differential diagnosis of diffuse parenchymal lung disease? First, infection. Infection consider one of the conditions that mimic or like interstitial lung disease. What are these infections? First, viral pneumonia. Second, pneumocystis jirovecii, mycoplasma pneumonia, tuberculosis, parasitic, example filariasis. Again, fungal infections might mimic interstitial lung disease. Other differential diagnoses or other conditions include malignant diseases like leukemias, lymphomas, lymphatic carcinomatosis, multiple metastases, I mean secondaries, bronchoalveolar carcinoma. As I mentioned in previous lectures, in the bronchogenic carcinoma, we said that bronchoalveolar carcinoma is a type of bronchogenic carcinoma, and it's mimic the pneumonia on the chest X-ray. Now it might mimic the interstitial lung disease or radiological feature. Other differential diagnosis of interstitial lung disease, pulmonary edema and aspiration pneumonia. So, we will discuss idiopathic pulmonary fibrosis as a broad type of diffuse parenchymal disease, and it consists about, as I mentioned, about or over 85% of condition of pulmonary fibrosis. Idiopathic pulmonary fibrosis is a specific form of diffuse parenchymal lung disease characterized by pathological or high-resolution CT scan evidence of usual interstitial pneumonia. So, It's characterized by pathological or high resolution CT scan evidence of usual idiopathic pneumonia. Familial cases are rare, but genetic factors that control the inflammatory and fibrotic response are likely to be important. And there is some evidence of genetic factor for the controlling of inflammation and the fibrotic response in the development or in the pathogenesis of idiopathic pulmonary fibrosis. There is a strong association with cigarette smoking. It's very important. Cigarettes are strongly associated with idiopathic pulmonary fibrosis. What about clinical features? First, the disease is uncommon before the age of 50 years, usually insidious in nature, progressive, breathlessness, and non-productive cough. So, the usual presentation is insidiously progressive dyspnea and non-productive cough. Unusual constitutional symptom is very important. Finger clubbings and the presence of bibasal, fine, late, and spread crackles are characteristics of idiopathic pulmonary fibrosis. The natural history is usually one of the state declines, but some patients are prone to exacerbation. I mean, it's a progressive disease and might be increase in severity with time. So the common clinical features: uncommon before the age of 50, insidious dyspnea and non-productive cough, unusual constitutional symptoms, basal, fine, late, and respiratory crackles with finger clubbings are present. The disease story or disease history is with steady declines with time. I mean, as a progressive disease. In advanced cases, patient might develop central cyanosis, and patient might develop features of right-side heart failure with leg edema, raised JVB, hepatomegaly. This is a finger clubbing, as you see. It's present in a patient with idiopathic pulmonary fibrosis. How investigate patient with idiopathic pulmonary fibrosis, or what are the investigations done to the patient with idiopathic pulmonary fibrosis? First, lab investigations include simple investigation, full blood count, calcium level, which may be elevated in sarcoidosis. LDH, lactate dehydrogenase, may provide many specific indicators of disease activity. Serum angiotensin converting enzyme level, which is again non-specific indicator of disease activity in sarcoidosis. ASR, C-reactive proteins, again non-specific raised in the idiopathic fibrosis. Other investigation, autoimmune screens for rheumatoid arthritis, like rheumatoid factor, for SLE, like anti-CCP antibodies, which are out to exclude the possibility of connective tissue disease as a cause of idiopathic pulmonary fibrosis. So the LDH, serum AC inhibitor level, serum angiotensin converting enzyme level, ASR, C-reactive proteins, all of these are non-specific elevation or non-specific indicators of a disease activity or disease severity in the interstitial lung disease or pulmonary fibrosis. Other important investigation done for a patient with idiopathic pulmonary fibrosis are radiological investigation. These include chest X-ray. I will show you a slide showing a chest X-ray finding. High resolution CT scan, very important in the, as I mentioned, in the definition of the idiopathic pulmonary fibrosis. Other investigation, pulmonary function test, spirometry, lung volumes, gas transfer, exercise, which especially the spirometry will show restricted type of pulmonary disease or obstructive lung disease. Other investigation, invasive investigation, bronchoscopy for bronchoalveolar lavage to exclude infection and to show the differential cell counts of the lavage. Other investigation, as I mentioned, invasive investigation, bronchial biopsy, which may be useful especially in the sarcoidosis. Other investigation, lung biopsies in selected cases, by means of transbronchial biopsy, especially in sarcoidosis, and to differentiate or to exclude infection and malignancy. Other modality of lung biopsy taken by video assist thoracoscopy, which is called VATS. Other investigations, liver biopsy may be useful, especially in sarcoidosis, biopsies other than lung, which is called liver biopsy. Other investigation, the assessment of the urinary calcium excretion, which may be help us in the sarcoidosis, would be useful in the diagnosis of sarcoidosis. This is a chest X-ray, which is show the bilateral, predominantly lower zone, as you see, and peripheral. This is peripheral, coarse, reticulonodular shadowing, and small lines. This is a chest X-ray finding of idiopathic pulmonary fibrosis. Bilateral, predominantly lower zone, and periphery, coarse reticulonodular shadow. So you see this is reticulonodular shadow in the basis and in the periphery. Other investigation, radiological investigation, as I said, CT scan, will show honeycombing and scarring. This is scars. These are scars, and these are honeycombing. This is a honeycombing lesion. This is especially in the periphery, shows the honeycombing. بالعربي خلايا النحل، كأنما خلايا النحل. This is very clear. This is a CT scan finding of idiopathic pulmonary fibrosis. This is at autopsy. The lung with end-stage pulmonary fibrosis at autopsy after death. This is showing the scarring and honeycombing, as I mentioned, X-ray, especially in the bases and in the periphery. And this is a scarring. This is a autopsy finding of lung after or at autopsy. How to manage patient with idiopathic pulmonary fibrosis? As I mentioned, idiopathic pulmonary fibrosis or diffuse bronchial lung disease are a heterogeneous group of conditions. Differ widely in presentation but might share other features of symptoms, signs, and radiological features. And there is a wide variety of differential diagnosis of idiopathic pulmonary fibrosis, so the management is challenging. This is very important. And include steroid therapy in the form of prednisolone combined with azathioprine, and maybe gradually reduce until reach the maintenance dose about 10 to 12.5 milligram daily. Other potential of therapies, the potential of therapies such as warfarin, anastacysteine, IFN, parafilone, pulsentan, and nitrous oxide, or etanercept, which is a biological therapy we'll discuss in the third stage and under the topic of pharmacology, which is called anti-rheumatic drugs, and specifically it is called biological therapy. Is being explored but cannot be recommended outside clinical trials at the present. Other modality of management, lung transplantation, and should be considered in young patients with advanced disease and in young patients fit for surgery, other than all patients with comorbidities and contraindication for surgery. Oxygen may be provided for palliation of dyspnea. Other treatment is a use of opiate, which may help to relieve severity of dyspnea. But the ultimate treatment for acute exacerbation is unknown. So, what about the prognosis of the idiopathic pulmonary fibrosis? The median survival of 3 years is widely quoted. However, the rate of disease progression varies considerably from death within a few months to survival with minimal symptoms for many years. So the rate of disease progression is different from death within a few months to survival with minimal symptoms for many years. The finding of high numbers of fibroblastic foci on biopsy suggests a more rapid deterioration. Idiopathic pulmonary fibrosis is associated with an increased risk of carcinomas of the lung. So, what about the management? First, steroid in the form of prednisolone Other potential therapies warfarin and stacycline, biological therapy, lung transplantations as one of the modality of treatment, and oxygen with opiate. Thank you very much.